Do you frequently feel like your heart hurts sometimes, not physically, but emotionally? Like you're suddenly overwhelmed with sadness, anger, or anxiety, a few days before your period? You're not alone. Meet Sarah every month, about a week before her period starts. She feels so down she cancels plans, snaps at her partner, and cries over small things, like a spilled coffee. This isn't just moodiness. It could be Premenstrual Dysphoric Disorder, or PMDD. PMDD is a serious mood disorder that happens in the days before a woman's period and goes away once the period starts. It's like PMS, but much stronger, to the point it can disrupt work, relationships, and daily life. So what causes PMDD? Well, think of your body like a radio station. Hormones like estrogen and progesterone are signals that affect your mood channel. In most women, these signals come and go smoothly. But in women with PMDD, the brain is extra sensitive to these changing hormones. It's not that the hormones are too high or too low. It's that the brain overreacts to the normal shift. Imagine your friend sending you a text saying we need to talk. Most people might feel a bit nervous, but someone with PMDD might panic, thinking the worst. Recent studies suggest genes may play a role too. If your mom or sister has PMDD, you might be more likely to have it. How do you know if it's PMDD and not just PMS? Think about Sarah again. Every month for at least 5 days before her period, she feels extreme sadness or irritability, can't sleep even when tired, feels hopeless, and loses interest in things she usually loves, like cooking or hanging out with friends. She might also feel tense, have trouble focusing, or even think, what's the point of anything? These symptoms stop a few days after her period starts. But here's the key, these aren't just bad days. They happen like clockwork every cycle and seriously affect her life. Other symptoms can include feeling out of control, extreme fatigue, or even physical pain like headaches or bloating that makes it hard to function. Diagnosing PMDD isn't like a blood test. It's more like detective work. Doctors ask you to track your moods and symptoms every day for at least 2 months. Apps like Flow or Clue can help you log when you feel down, angry, or tired, and when your period comes. This diary helps your doctor see the pattern. If symptoms happen only in the days before your period and improve after it starts, and if they cause major problems in your life, you might have PMDD. Treatment options include antidepressants, SSRIs taken just during the 2 weeks before your period, or birth control pills that stop ovulation. Therapy like CBT, cognitive behavioral therapy, also helps. It teaches you how to reframe negative thoughts. For example, instead of thinking I ruined everything, you learn to say, I'm feeling strong emotions right now, but it's temporary. You can't change how your brain reacts completely, but you can soften the blow. Think of it like preparing for stormy weather. If you know a storm is coming, you bring in the laundry and close the windows. With PMDD, you can prepare by exercising regularly. Even a 20-minute walk helps. Eating balanced meals with less sugar and caffeine, getting enough sleep, and practicing mindfulness or yoga gives your brain stability. Talking to your partner, boss, or friends about your cycle helps them understand why you might need extra kindness those few days. Tracking your cycle and symptoms every month helps you predict and manage the tough days, like setting a reminder that says, this week, be gentle with yourself. Science is learning more about PMDD every year. In 2023, researchers found that women with PMDD have a genetic difference in how their cells respond to hormone changes, like a sensitive setting in the brain. This helped confirm PMDD isn't just in your head, it's biological. New treatments are being tested, like a drug called zuranolone, which targets brain receptors affected by hormones. It's still early, but it could one day offer relief without daily pills. Also, mental health apps now include PMDD tracking with mood analytics, helping women show doctors clear data. These advances bring hope, and validation that PMDD is real, treatable, and nothing to feel ashamed of.